Knock, knock. Hi. My name is Delaney. I'm a student nurse from Clemson, and I'm going to be performing a head-to-toe assessment on you today. And I'm going to report my findings to my instructor, and I'll tell you what I'm doing as I go along. But if you have any questions, please feel free to stop me.
Okay, great.
And I just washed my hands. I'm going to close this curtain for privacy. And could you start by telling me your name and your date of birth?
Elizabeth Blakeney, 2/24/97.
Okay, perfect. And I'm just going to start off by taking your blood pressure. So you can just sit back.
Do you need me to take this off?
Sure, yes, that would be great. Okay, so first I'm going to just start off by getting a systolic baseline, so I'm just going to pump you up. Okay. Okay, perfect, Ellie. Blood pressure is 122/76 on the left arm, which is within normal range. And now I'm going to start by assessing your skin. If you could tell me, I'm just going to ask you a few history questions. Do you have any history of skin disease?
I do not.
And what about any current rashes or lesions?
Not currently, no.
And then do you have any excessive itching or bruising anywhere?
No.
Perfect. I'm just going to look over your skin. If you could just uncross your legs for me. Okay. Just up a little bit. Okay. And all skin seems to be intact. I don't see any edema, lesions, rashes, any abnormalities. You have, your skin seems to be tan. You have a few flat macules on the side of your cheek, but there's no real areas of concern. And I'm just going to pinch the back of your hand really quickly. Okay. Skin is smooth and easily mobile with skin tuger check showing rapid recoil and without any tenting. And next I'm just going to feel with the back of my hand for temperature. Okay. And patient is warmed bilaterally with appropriate moisture on all around your skin. And so now I'm going to move on to assessing your lungs. Could you tell me if you currently have a cough?
No.
And do you smoke?
I do not.
And do you have any chest pain or tightness or anything like that?
No.
Okay. And I'm going to start by just kind of like observing your chest. If you could just breathe a little bit deeper through your nose for me. And patient shows no cyanosis or pallor, no nostril flaring or retractions, which would indicate chest pain. And the thoracic cage appears to be symmetrical with the AP diameter less than transverse, which is perfect. And now I'm going to listen for your lung sounds, so just take some deep breaths from me. And bronchiovesicular lung sounds are clear. Bronchial lung sounds are clear. And if you could just sit up, I'm going to do the same on your back. Okay, like perfect. And vesicular lung sounds are clear and present as well as symmetrical. So no adventitious sounds were heard, such as like rails, wheeze, crackles, or stridor, and all of your appropriate lung sounds are present and clear and symmetric. Now I'm going to assess your heart. Do you have any family history of heart disease?
I do not.
And do you have any swelling in your arms or legs?
No.
Okay, perfect. I'm going to have you sit up a little bit more for me, and I'm just going to start by checking your pulses one at a time on each
You want me to
side.
stand?
Yeah, sure. Stand. Good. Starting with your carotid. And now your brachial. And your radial. And your femoral. Popliteal. If you could just take off your shoes real quick. And your dorsalis pedis and posterior tibia. And all pulses are 2+ and strong bilaterally. Everything looks good there. Next, I'm going to listen to your, you can sit back down, your neck vessels. And I'm going to start with the aortic, which is the second intercostal space, right sternal border. And then your pulmonic, which is the second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fifth intercostal space, left sternal border. And mitral, which is fifth intercostal space, left midclavicular line. And now I'm just going to listen again for any extra heart sounds or murmurs in the same spots. Aortic, pulmonic, Erb's, tricuspid, mitral. And so S1 and S2 are clear and present and at a normal rate. S1 is heard loudest at the apex. There's no extra heart sounds or murmurs. And now I'm just going to listen for your apical pulse for 1 minute. Okay. Apical pulse is 72 strong, found at the fifth intercostal space, left midclavicular line. So everything is good there. Now, lastly, I'm just going to assess for any edema. And no edema is noted, so it's 0+. Now I'm going to move on to your abdomen. If you could just lay down with your knees up. Do you have any history of GI problems?
I do not.
Any changes in appetite or difficulty swallowing or anything like that?
No.
Okay, perfect. So I'm going to start by listening for your vowel sounds in all 4 quadrants, starting the right lower quadrant and moving clockwise. Just take a long breath for me. Okay, and you have active vowel sounds in all 4 quadrants, which is good. And now I'm going to listen to see if you have any bruits, starting with your aorta, your renal, iliac, and femoral. I'm just going to do that on both sides. Okay, and no bruits were heard. And now I'm going to just palpate your abdomen, starting with light palpation, then deep. Again, all 4 quadrants. Tell me if you feel any discomfort. Okay, perfect. And now I'm going to palpate for your liver, using deep palpation and your spleen. So I felt no tenderness, rigidity, or enlarged organs. Did you feel any discomfort or anything?
No.
Okay, perfect. And now I'm going to move on to an eye exam. So if you could just sit up for me and look forward. I'm going to use my pen light to just assess your eyes. So if you just look straight forward for me. Okay, perfect. Pupils are round, equal in size, reactive, and accommodate about 4 millimeters. So now I'm going to check your neck and your head by looking at your lymph nodes, and starting with the preauricular, postauricular, submental, submandibular, tonsillar, anterior cervical, posterior cervical, supraclavicular, and inferior clavicular. And no visible or palpable lymphadenopathy in all 10 nodes. All the nodes are mobile, distinct, and non-tender. Okay, now I'm going to move on to your musculoskeletal system. To assess your range of motion in your joints and just check for any crepitations, masses, edema, and your strength. Could you start by telling me, do you have any problems with your joints?
I do not know that I know
Any muscle pain or cramping?
of. No.
Okay, perfect. So I'm going to start with by assessing your hips. If you could just lay down for me. Actually, we'll first stand up and just walk a few feet that way and a few feet back, just so I can assess your... Okay. Patient seems to have smooth gait and iliac crests are symmetric. I can just lay back down for me. And I'm going to start by assessing your flexion. If you could just put your legs straight up on both sides. Perfect. And then hip flexion, so bend your knee and put it towards your chest on both sides. Great. And now I'm going to have you do abduction, which is out, and adduction, which is in. And put abduction back in. Yes. And then I'm going to have you do internal and external rotation. I'm going to have you bend your knee, and I'm going to put your foot forward, internal and external. Great, same one. Internal, external. Okay, so range of motion appears to be 5 and active. I don't see any edema, deformities, any issues there. And now I'm going to assess your shoulders if you would like to sit up for me. And then put your arms up like this for flexion, extension. Perfect. And then internal rotation like this, external rotation like this. And then I'm going to have you do abduction, adduction, abduction, and adduction. Okay, perfect. And the shoulders seem to be similar contour and size. They're symmetric. I don't feel any edema or deformities or anything like that. Range of motion is 5. Next, I'm going to check your neck. If you just would start by looking down for me like this for flexion, and then hyperextension like that. Perfect. And then just rotate your neck around for rotation and lateral bending ear to each shoulder. Okay, perfect. Everything looks good there. The neck doesn't seem to have any edema or redness or anything like that, any rashes, and no deformities or foul. So that's all good. And now I'm going to check your elbows. I'm just going to palpate and feel around. They look good. And I'm going to have you flex and extend. And no pain or anything?
No.
So range of motion again is 5. Next, I'm going to check your knees. And first, I'm just going to look at them, see if there's any deformities or anything, and they look symmetrical. And I'm going to have you stand up and put it against your butt like that for flexion. Perfect. And you seem to have distinct concavity on each side of the patella, which is good. And then I'm going to assess your spine. So if you could stand up for me and just bend over. Okay, perfect. And you can see back up. No scoliosis or abnormal curvature is seen. So I'm going to have you do lateral bending. And I'm going to have you hyperextend your back. And then I'm going to have you rotate just kind of like this. Perfect. And then I'm going to have you check for sciatic pain. So I'm going to have you just put up each leg like that. And any pain?
Nope.
Okay, perfect. So everything in the spine looks good. You can sit back down. Seem to have full range of motion there as well. And now I'm going to check your wrists and hands. If you could just spread out your fingers for me. And I don't feel any nodules. Doesn't look swollen or anything like that. If you can make a fist and flex and extend. Perfect. And touch your thumb to each finger. Great. You have full range of motion in your ankles, and your wrists as well. And now I'm going to check your ankles, starting with plantar flexion, dorsiflexion, and I'm going to have you invert your ankle and evert on both sides. Okay, perfect. And range of motion there seems to be 5 as well. I don't see any deformities, any nodules, redness, edema, any abnormalities in any parts, and you seem to have full range of motion everywhere. And so now I'm going to check your neuromuscular system, neurovascular, by looking at your cranial nerves. So first I'm going to have you close your eyes. I'm going to see if you can identify the smell to check your olfactory nerve.
Peanut butter.
Perfect. And another one.
Nail polish.
Great. Okay, so olfactory nerve seems to be intact. And now I'm going to check your optic nerve. If you could just stand up and stand right here for me and cover one eye and read the third line on that chart for me.
2843.
Perfect. And cover the other eye. Do the same.
2843.
Okay, great. You can sit back down. So optic nerves seem to be intact as well. So now I'm going to check your oculomotor, abducens, and trochlear cranial nerves, and I'm going to just have you follow my finger, and I'm going to check for your 6 cardinal movements. Just follow my finger with your arm. Okay, perfect. And those seem to be intact as well. And now I'm going to check your trigeminal nerve by having you clench your jaw and move it side to side. Okay, perfect. And no pain or anything there?
No pain.
Okay, great. And now I'm going to check your facial nerves. I'm going to have you smile and puff out your cheeks. Okay, perfect. And everything looks good there. Next, I'm going to check your acoustic nerve by whispering a word into your ear, and I'm going to cover the other ear, and if you could just tell me what it is.
Dog. Animal.
Okay, perfect. So the acoustic nerve seems to be intact, and next I'm going to check your glossopharyngeal and vagus nerve by having you open your tongue and say ah. Open your mouth. Perfect. And uvula seems to be midline. And next I'm going to check your spinal accessory nerve, and I'm going to have you just shrug your shoulders against some resistance. Okay, perfect. And no pain there?
No pain.
Okay. And lastly, I'm going to check your hypoglossal nerve by having you stick out your tongue and move it side to side. Okay, perfect. And tongue is midline. So lastly, I'm going to check your reflexes, starting with your, if you could just put up your sleeves a little bit, with your brachial reflex. Perfect. And then you have your triceps, if you put your arm like that. Great. Okay. And next, I'm going to check your brachioradialis. Okay. And now I'm going to use the other side to check your plantar reflexes. If you could just sit maybe on this pillow so your feet hang off. Okay, great. And now I'm going to check your Achilles reflex. So I'm going to have you point your foot up. Let me take off your shoes a little bit. Point your toe up and have it flex. Perfect. Great. And lastly, I'm going to check your plantar reflex. I'm just going to put this there. Great. And all reflexes are adequate and 4+, and overall everything looks great.
Thank you, Nurse Delaney.
Wow.